My name is Dr. Sandra Rao, and I am a full-time emergency physician practicing in a very ethnically diverse urban setting in the Greater Toronto Area. I also work in rural hospitals across Ontario. Today, I am here representing myself to provide testimony on the impact of population growth on acute care health utilization. In my practice, I see a wide variety of patients from different backgrounds: citizens who were born in Canada, first-generation immigrants who have been here for decades. I also see a substantial number of patients who are newcomers who have only come in the last few years, as well as international students and refugee claimants through the Interim Federal Health Program. According to Stats Canada, in 2023, the vast majority, around 97.6% of Canada's population growth came from international migration, both permanent and temporary, and the remaining portion, 2.4%, came from natural increase. Ontario specifically, its population growth since 2021 has been unprecedented, driven almost entirely by international migration, and had the highest growth in 2023 of 3.1% of any single year since 1972, and more than double the average population growth of 1.3% over the last 50 years. However, our healthcare infrastructure, particularly acute care beds, emergency departments, and family physician supply, has not expanded proportionately. Though healthcare is delivered provincially, federal immigration policies impact our healthcare outcomes directly. In Ontario, the number of acute care beds have decreased since COVID levels and have remained stagnant. At my centre, our ED volumes have increased by at least 11% year over year since the pandemic. Visits by refugee claimants have increased by almost 490% since 2021. The rate of admission among these ED visits has remained the same, thus the total number of admissions is still rising year over year. According to the Financial Accountability Office, there were 35,540 funded hospital beds in Ontario in 2024 to 2025. And based on the 2025 budget, there would be sufficient funding for 33,083 beds by 2027 to 2028, resulting in a decrease from 220 beds per 100,000 Ontarians to 203 funded hospital beds per 100,000 Ontarians. This trend would not even meet the needs of an aging population, let alone from accelerated immigration. This is the same story across the country. Population increases also impacts the physician workforce. In a briefing regarding the Ontario Medical Association's negotiations with the Ministry of Health, unprecedented population increases were directly cited as a reason for lower than anticipated compensation for physicians. As we see with what is happening between the Quebec government and their physicians, provincial physician funding has a direct impact on physician attrition in the province. In our centre, the bulk of increases in our ED volumes are accounted for by ambulatory low acuity volumes, which is also likely exacerbated by insufficient access to family doctors from an existing crisis in primary care. According to the Canadian Institute for Health Information, family medicine physicians experienced slightly negative growth of 0.1% from 2022 to 2023. This then spills into ED wait times, referral to specialized clinics, and worsened wait times for specialists. Newcomers often also face challenges in accessing healthcare, including significant language barriers, lack of primary healthcare, low health literacy, all of which require additional resources and personnel to properly address. There are also differences in healthcare expectations as well. Many newcomers come from countries where there isn't an established primary care system, so they may expect to see specialists or obtain advanced imaging right away, not being aware that such a referral can take months. Thus, the inability to meet healthcare needs of the population increases disproportionately affects newcomers, and if immigration levels continue to be mismatched with provincial healthcare delivery, outcomes will suffer for all Canadians.